classic, ortho.
Well, that's absolutely what I lead. How to
Well,
get
it's
that?
true. Well, it's true. It's just absolutely true. I mean, it's not something you believe. It's math. It's physics.
No, I agree that. I agree with that. And it's not. You can name all of those things: fast braces, high speed braces, 6 month smiles, all of those things. All of those are aimed at showing the dentist how and how to do it and how to do it quickly and how to make money. But nobody talks about the when, the why, and the underlying principles about it.
The diagnosis and treatment plan.
Yeah, that takes time and that takes effort and that takes energy. 6 month smiles, for example, or high speed braces or fat braces. All that is the first 3 to 4 to 5 to 6 months of orthodontics. Okay, after that, if you don't care about finishing the case or establishing occlusion or making sure the CO and CR are in harmony and all the other fundamental things that we need to think about, you could do 6 month braces. Somebody who finishes my program, they can do 6 month smiles. Just stop after you line up the 6 upper and lower anterior teeth. That's what I call half-ass orthodontics rather than high-speed braces. But if you want to do that, you can. You talked about Invisalign. Most of those programs are selling appliances or a technique. They're not selling an orthodontic education. And you talk, Invisalign is a classic example of outstanding marketing, selling a relatively straightforward, simple appliance. It's a product. It's like people say, I'm an Invisalign orthodontist, and I ask them, have you ever gone out telling anybody you're a 557 crosscut Fisher Bird dentist? Because that's what it is. All Invisalign is a tool that some people use. It has significant limitations. It has a certain place, especially in our adult patient population who are aesthetic conscious. But even to use Invisalign, years ago I was asked by the people who were started Invisalign before it went into all this other large corporation stuff, would I be interested in teaching some courses? And when I said yes, my premise was the appliance is great, but before you start using Invisalign or any other quick treatment protocol, you need to understand, as you just said, diagnosis, treatment planning, bone muscle interaction, long-term stability, instability issues in orthodontics. You need to understand all of orthodontic diagnostic modalities in order to make appropriate diagnosis, and then decide which tool that you want to use to solve the problem. The problem is if all you have is that one tool, everything looks like a perfect case for that tool. You know that old saying, if all you have is a hammer, everything looks like a nail? But if all you have is Invisalign, everything looks like a non-extraction, simple alignment kit. And unfortunately, that's not true. So it is a very effective tool on a very, 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 very limited number of patients. And I don't have any problem with the tool. I have a problem with the people using it who haven't had any education to understand what they're doing.
Man, that Invisalign. That's been a hell of a stock, hasn't it? I mean,
5-year,
20 to 60. What a stock that thing's been.
From a business standpoint, it was a genius marketing play.
Yeah, and now, is it true that the patents are kind of coming to an end, and there'll be more competition with what is this?
Yeah, that has happened. I don't follow that very closely, but from what I understand, that happened a number of years ago. Because you have other corporations that have all added a series of alarms now. There's Clear Correct, and there's half a dozen others. Actually, you raise a really good point, and we can talk about it right now. I was doing a presentation at the San Diego Dental Society meeting not that long ago, and someone asked me about Invisalign. And I just happened to have seen the day before an advertisement that showed you can now order your trays. You can bypass, you the patient can bypass the dentist now and order trays and paperwork that you can design your own treatment and send it to a company that will send you back the trays. Do you remember the company called Sharper Image?
Yes.
And the catalog? Well, they used to have an ad where you could buy this box, and you could, inside that box was a kind of impression material. You could stand up, put your foot in that box, take an impression of your foot, and send it to the lab, and they'd make an orthotic, and we don't need the podiatrist anymore. Well, they're doing that now with clear aligners. So
who's doing that?
Not only is the patent gone, and companies like Clear Correct and some of the other big corporations are selling clear aligners. Every orthodontic supply company has a division selling clear aligners now. But you don't even need the dentist anymore. You can go right to the patient. You can buy impression material and send it to the lab.
Do you know the name of that company?
Smile something. But I don't know it off the top of my head, but I can get it to you at a later point.
Okay, yeah, send it to me. Are you gonna? That's amazing. Hey, speaking of, you said ortho takes 2 or 3 years. Not to get off topic, but we see advertisements for things that accelerate ortho,
Yeah.
propel, things like that. Is anybody that got your attention?
Oh my attention, and I would be very excited to see it happen. The only one of all those things that's showing um, any evidence that it actually has some degree of speeding up orthodontic tooth movement is the traumatic, the controlled trauma. It started with the Wilkes brothers doing their surgical procedures, perio and ortho combination, where they lay a flap and do corticotomies in between all the teeth, and then you hide the teeth. The traumatic injury increases cell turnover rate, and therefore it speeds up tooth movement. It's a rather aggressive and a major surgical intervention and extremely expensive. Then somebody got the good idea of maybe we can do interproximal microtraumas, similar to Propel and some of these other ideas. And so they're trying to do that by changing cell turnover rates and speeding up tooth movement. Wonderful, biologically sound concept. Not a shred of scientific evidence available yet anywhere in any publication that it has any clinical significant effect in speeding up treatment. Is there hope? Yes. There's hope in terms of injectables. There's hope in terms of controlling things like injecting prostaglandins into the periodontal ligament. So it is actually, Jeff, a really good question. That is really probably the forefront of orthodontic research at most of the universities today. You know, a number of years ago is when the functional appliances work. And then it went on to, mechanical things and technical things. But now, seems to be that the research that I'm seeing is in the area you just asked about. What are the possible ways in which we can speed up treatment? And you know, Howard, all of that has been triggered by one thing.
Money's the answer. What's the question?
Yeah, no, that wasn't that wasn't what I was thinking. But yeah, bottom line that too. What it's been triggered by is the same thing that triggered Invisalign, the same thing that triggered clear appliances, the same thing that triggered all these synthetic appliances and the white wires and all that. Adults seeking orthodontic treatment. And the only reason adults are seeking orthodontic treatment is because we have made orthodontics so efficient now that the orthodontist can handle, the trained orthodontist can handle 500, 600, 700, 1,000 cases a year in his or her office. Where when my predecessors started 2 generations ago, if they were lucky, they started 50 to 90 cases a year and they did everything by hand. So